Hello people, in this video we want to look at hemorrhoids. It's also called as piles. See the spelling first of all. Hemorrhoids, okay. Some people can write hemorrhoid, okay. So you have to remember the spelling and look at the hemorrhoid here. They're showing the normal positions, very common ones, 3 o'clock, 7 o'clock, 11 o'clock. These are the positions in which you can see internal hemorrhoids, okay. So let's anyways get started and understand what this hemorrhoids is. So basically we are looking at rectum and anal canal. So let us say we are looking at anal canal here. What will you see here? These veins, right? Whatever veins are there in your anal canal, they can be dilated. Okay, that will be called as hemorrhoids. And why do these veins dilate? Because either they're standing long time, so they're getting pulled kind of a thing, or hemorrhoidal veins they're getting compressed, is it? Whenever you're defecating, okay. Family, genetic factors, diet, basically these people have constipation, etc. Their diet is not good enough for passing stools, so those people can have this. Then coming to secondary hemorrhoids, secondary means because of some cause somewhere, some other cause, right? Not directly because of your stools, etc. The carcinoma of the rectum, portal hypertension, remember where there is increased portal hypertension, there can be portocaval anastomosis, etc. But they are saying this is an uncommon cause, okay? But every time we write portal hypertension, you remember we have written hemorrhoids as one of the result of portal hypertension, right? Pregnancy and obviously wherever there is extra abdominal pressure, constipation, obesity, pregnancy, all that you will have hemorrhoids. Guys, are you understanding? What are we looking at? Hemorrhoids. Okay, so dilated veins, anal canal. This can be because of increased pressure, pregnancy, gravity, carcinoma of rectum, or because of the diet. Now that we looked at the causes of hemorrhoids, now let us look at the location. See, based on this pectinate line, right? This is called pectinate line, right? So above it, whatever is there, they are saying it is internal hemorrhoid, and below, if there it is there, it is external hemorrhoid. Remember, whatever is above is the endoderm, and outside is the ectoderm. Okay, origin. So that is why you should know that ecto will have nerves, right? Like skin. So external will pain. Okay. So look at the location and all. So in the internal one, they are saying that 6, 7 and 11 o'clock positions are very classical, right? 3, 7 and 11 are very classical. 3 o'clock means somewhere here, 7 means somewhere here, and 11 means somewhere here, right? So this is nothing but left lateral, right posterior, and right antero, etc. Okay. So these are the locations. Now let us go to the clinical features. Painless bleeding. So if it is internal, painless bleeding. Okay, and this bleeding occurs after defecation. So there will be splash in the pan, so much of blood in the pan, bedpan or the commode. And this can cause anemia because they are losing blood, right? The hemorrhoids which bleed are called as grade 1 hemorrhoids. So the ones that bleed itself are grade 1. Later on it becomes painful, looks like. Okay. As the straining increases, what happens? They will start coming out slowly, okay? I mean, when it comes out, but it can return back, it is grade 2. When it comes out and it can push it back, yourself, I mean, it doesn't go back by itself, but you can push it back, then it becomes grade 3. And it is permanently outside, becomes grade 4, okay? So we are talking about hemorrhoids, the location you saw, clockwise position you saw, and based on whether you can push it back or not, that also they told you. Wait, look at this. So here you can see that, where are we focused, guys? Grade 1. Grade 1 is something like this. It will just bleed, okay, bleed. Grade 2 is whenever you defecate, it will come out, okay, but it will go back by itself. Grade 3 is it will come out and you can push it back. You need to put some force and push it back. That is grade 3. And it is always outside becomes what? Always outside becomes grade 4. Okay, this is your internal hemorrhoid things, grades that told. Grade is for what? Internal hemorrhoid. So this is the same classification that we told you about. Permanent prolapse is grade 4. Okay, and these people will have pain. Bleeding can be there in this also, looks like. Okay. What investigations will you order for these people? Think about it. Will you do a rectal exam? Will you order some scopy, sigmoidoscopy, etc.? So basically flexible sigmoidoscopy you can do. Per rectal examination you can do to rule out carcinoma. because you can feel a hard mass, right? Because this also, carcinoma also can cause bleeding per rectum. Then, hemorrhoids cannot be felt in rectal examination unless they are thrombosed or fibrosed. This you should keep in mind a lot, because there's no point in doing rectal examination then. So why are you doing rectal examination? Only to rule out carcinoma. Very good. So let's put that here. So, okay, then proctoscopy. Proctoscopy means you're introducing something into the anal canal, is it? As the obturator is removed, piles prolapse into the lumen of proctoscope as cherry red masses. This would be nice to write in the exam. Cherry red masses in proctoscopy. What is proctoscopy? What is sigmoidoscopy? What's the difference? Sigmoidoscopy sounds a little more deep, sigmoid colon kind of a thing. Proctoscopy is more superficial, but what they are saying is you should do flexible sigmoidoscopy. You have to go deep. That's what they are saying. And any of these procedures is only to rule out cancer. Okay, this is the whole principle of investigation. What is the goal of investigation? To rule out cancer. What are the complications of hemorrhoids? Guys, focus here. We're now looking at the complications of hemorrhoids. You just leave the hemorrhoids. What will happen? Pain? Yes, pain. I really couldn't take this pain. Very, very bad pain, huh? Especially the external hemorrhoids. What about this? You will lose blood, if bleeding, anemia they can have. Strangulation can happen, right? Venous congestion. So strangulation. So what will happen? There will be more pain. And ulceration, secondary infection, thrombosis, fibrosis, all this can happen. Now, if there is strangulation, what will you tell? You will tell the patient to elevate the bedside, okay, so that venous congestion won't be there. Venous return can happen to the heart. Metronidazole, you can give them to prevent infection, looks like. Saline dressings to reduce the edema. And lignocaine jelly. This will reduce the pain, local anesthetic, and also it will lubricate, right? In case they are passing stools. Look at this. Strangulation, ischemia will lead to what? Suppuration, infected pile, ulceration, thrombosis, fibrosis, gangrene, and pyemia. So these are the complications of piles. Okay, strangulation will lead to all this. Okay, very good. So did you understand the complications of hemorrhoids? Very good, people. Now let's go to the next thing. How will you treat it? There is non-operative treatment for grade 1 and grade 2. Okay, so non-operative means tell them to eat nicely, take food, fiber. Then purgatives, laxatives you give them. Reading in toilet is discouraged. Yeah. Don't go and sit on the toilet and push. Okay. What they're saying is when you want to pass, no, that time you go to the commode and tuck, you pass it off. Okay. Don't strain. You got what I said? Wait for it to become urgent and then go to the bathroom. Don't go there and try to evacuate your bowels. Okay. Encouraged to lose weight because of all that abdominal pressure, obesity, etc. This is non-operative treatment, guys. Now let's go to the other treatment. Okay, treatment of hemorrhoids. Okay, injection of a sclerosant. So you'll put some sclerosant and you will harden it. Sclerosant. Which is the sclerosant? 5% phenol and almond oil is injected. This is nice. Actually, I never saw people do this. This is sounding so nice. Okay. Then this should be green. It's treatment. Yeah. Then Barron's band application. So you'll put some band. Okay. Look at that. It's just a rubber band kind of a thing. See, on that black rubber bands are sitting on the ligator. Then they're catching hold of this internal hemorrhoid, which is of a low grade only. And then they're pushing this rubber band onto this and they're ligating it. So this is Barron band application for grade 2 and grade 3 hemorrhoids. Okay. Then you have operative treatment. That is operative. What will you do? The name is so easy. Hemorrhoids treatment by surgery, hemorroidectomy, open method, closed method, stapler, hemorrhoidopexy, so many other. Okay, so this is operative. Now we have to look at what? Hemorrhoidectomy. We have to look at this one now, right? Interestingly, they are saying that this is indicated only for grade 2 and grade 3. Then what will they do for grade 4? Okay. And what will they do for external one? The thing with external is, it's a 5-day painful self-curing lesion. It's painful, right? But it is self-curing. So that is, they just don't want, surgery is not covering this. Only internal they are covering. But internal is painless. Who will come for treatment, you tell? Unless it is bleeding. Oh, but grade 4 is painful. But grade 4 they are not doing hemorrhoidectomy. Now this is confusing, isn't it? See, though this one is internal, grade 4, there is pain in this one. Okay. Okay, let's come back to this hemorrhoidectomy. So you have to treat grade 2 and grade 3 hemorrhoids. You can do either open method, closed method or stapler. So please focus on open one now. Ligature and excision, open method. Open method means you're leaving it open, the blood can drain, it can escape, okay? You understood, right? That is the open part of it. And here you're giving some non-adsorbable silk ligature, looks like. Fine. Now coming to the closed one. Closed one is basically the skin edges are sutured. Okay. So you're suturing it at the end of the closed method. This is Ferguson, closed method. So these people will have to do a lot of things even after the operation. What are they telling here? They will get analgesics, antibiotics, purgatives, sitz bath. They will have to sit in warm saline or potassium permanganate solution so that all the bacteria can die, isn't it? A warm saline they'll have to sit in. Just take a tub, a flat kind of bucket and fill it with warm saline water and sit in it for a few hours, okay? Hours? Half an hour? The last one you have to know is hemorrhoidopexy. Stapler. Can you say hemorrhoidal? Hemorrhoidopexy. Stapler. Non-excisional. Yeah, this is a non-excisional in some novel model. This is what they. Okay, focus. What are they doing here? See, you can see here they are putting some stapler here, which has some circular stapler, and here you can see in mucosal line they have put staples here. Can you see here in this image staples? So there are 2 rows of staples, 28 staplers will be there. So what will happen, they are not doing anything to the hemorrhoid, but these hemorrhoids will eventually regress because of this staples here. So this is staplepexy. So circumferentially they are doing something, right? So it looks like a donut. They are saying circular ring of mucosal tissue above the line of dentate, the line is removed. Internal hemorrhoids are not removed. External hemorrhoids are also not removed. They only regress by themselves later. 2 rows of staples, 28 staples. Okay. So this is easier to operate. They are saying there will be less bleeding. There is less pain after the operation. There is less need for analgesia, obviously, because there is less pain. Post-operative stay in the hospital is less. Part of daycare procedure you can do. Okay. Earlier return to normal activities, all standard things only they are writing. No long-term side effects, etc. Disadvantages is very high cost of instrumentation. Imagine that stapler and all you have to buy, right? And special training for the doctor. Rare complications can be there like post-operative bleeding, etc. Okay, but these staples inside, 28 staples, are they going to come out by themselves? Strange, that they didn't write in this book. In open hemorrhoidectomy, if wound is like clover, it is over. In stapler hemorrhoidectomy, if donut is complete, it's time to celebrate. Wow, okay. Is it time for you to celebrate? That we don't know from the textbook. There is one more here to study. Doppler guided hemorrhoidal artery ligation. Just hold that hemorrhoidal artery and ligate it. Where is that hemorrhoidal artery? See, here that superior hemorrhoidal artery, just ligate it. Some figure of 8 suture they will put and they will ligate it. Okay. Something like this, figure of 8. Right? What do you say, people? So this is the Doppler guided, looks like. Doppler guided. Did you get it, guys? So we have looked at hemorrhoids in this video. So whatever we told you is more like treatment for internal hemorrhoids. External, what will happen to external? External hemorrhoids. These are the ones that are painful, but they are self-curing. Too painful means then you go do a surgery and remove the clot. Okay, so this is all about hemorrhoids. We have studied hemorrhoids in this video, piles. Aren't we done, guys? See you, bye-bye.